Good morning, good afternoon, and good evening, everybody, and welcome to this version of the project presentation concerning the Awaaz Information and Accountability Center here in Afghanistan. My name is Paul Cruikshank. I'm the UN Ops Director and Representative for Afghanistan, and it's my great pleasure and privilege to be able to present this project, which has been selected for the Paris Peace Forum 2020, to you today. I'm going to start by going to the presentation itself. That's all disappeared. What can you see at the moment? Where is the presentation? Where did it scroll back up? Sorry for this. Okay, we have a bit of an issue here. On the left, it says. Sorry about this, we're just trying to bring the presentation up. Okay, well, having a bit of a technical issue here in Afghanistan, so I hope you can see the presentation. Can you see the presentation? Okay, good. Okay, we'll move on. I hope you can see the next slide, which shows the current situation here in Afghanistan as far as the overall situation is concerned vis-a-vis the GDP per capita. And as you can see from this slide, Afghanistan is very much a fragile state. It continues to be very adversely impacted by conflict. And this conflict has been ongoing effectively and impacting directly the people of Afghanistan for the last 4 decades. The result of this is that it has a massive socio-economic impact on the country and on its people. You can see in the slide here that the population of Afghanistan is over 38 million. The population itself has increased quite significantly over the last decade, as we've seen more and more people having to return and wishing to return into the country from neighboring countries, in particular Iran and Pakistan. 9.4 million people are desperately in need of humanitarian assistance at this stage during the course of this year. And since 2012, 4.1 million, at least, people have been internally displaced within the country. And since last year alone, nearly 500,000 people have returned from its neighbors to the west and to the east. This is putting an enormous amount of pressure on Afghanistan, especially considering the ongoing conflict. Conflict, man-made, and also natural disasters result in multiple repeated shocks and stresses being imposed on the people of Afghanistan. And it is because of this that a decision was taken to initiate a response to support the overall humanitarian effort led by the government of Afghanistan and also its international supporting entities, the UN and other international entities such as the European Union. We started to put this project together in 2018, and we were very much grateful at the time and continue to be grateful for our major sponsors, UNHCR and WFP, who led intellectually the effort to establish this call center facility. And we're also extremely grateful to the European Union, ECHO, and also the Afghanistan Humanitarian Fund for their continuous and hopefully in the future continual financial support, which makes this facility sustainable now and hopefully in the time to come. Communications saves lives. What does that actually mean? As a result of establishing the Awaaz call center, we are able to provide effective outreach to the population in the country. We have established, with our partners in the government of Afghanistan, a free, toll-free number, known now as simply 410, which is accessible to each and every Afghan who has access to a telephone. In years gone by, the spread of mobile telephone technology was limited, and most communications back in 2002 and onwards went out via communication means such as radio and television. As the years have gone by, more and more people have access to mobile telephones, and therefore this toll-free number does allow that access to be spread across the population. And even if people do not actually own a telephone themselves, they are able either to borrow a telephone, mobile telephone, or they have access in a local shop to a telephone. And because it's a free number, other people are more than happy to allow others who do not have possession of a telephone to gain access to this toll-free number. And that has made sure that our accessibility is maximized at all times. Through this, we are able to apply accountability to the whole population, but in particular, the affected parts of the country. Accessibility is very much based on confidentiality. We have 10 operators working in the call center, both men and female, 50% of each. They are multilingual. The call center operates 365 days a year. And even if a call comes in the middle of the night, when the call center may not be open, all calls are registered so that we can pick up calls that have been left in terms of messaging, and all those calls will then be responded to in due course. We also offer a complaints and feedback mechanism, not only in terms of complaining or feeding back about the Awaaz facility itself, but more importantly, complaints and feedback are registered, analyzed, and communicated to our humanitarian partners should they actually be focused on those entities themselves. What you see in this slide is a snapshot of the Awaaz facility's dashboard. And in this dashboard, it is possible to interrogate and record all data that comes in on a confidential basis, as I said, to the call center. You can see there that as at the end of last month, we have now registered well over 140,000 calls since this call center was opened in May 2018. We're able to collect data on who is calling, from where they are calling, the types of callers, whether they're male, female, their age groups, what district that they're in, and also of great importance, of course, is what sectoral area they are calling about, whether it be food, shelter, or protection, or any other such natured call. This is readily available and can be accessed by anyone online. The Awaaz facility is having a direct impact on people here in Afghanistan, most notably those who are most affected and most threatened by either man-made or natural incidents. What you can see on the slide here and on the subsequent slide in a moment are some of the testimonials which have come in from this to this call center. On this one, no one can cheat us anymore, as we can now have our Awaaz, an organization who listens and raises our voice. And what that represents, of course, in this case coming from a caller in Saripul, is that we do listen to people. We do make sure that their issue is addressed. And not only do we listen, we also feedback and evaluate. And what I mean by that is, having passed this information on to one of our humanitarian partners, we do ensure that we call back to make sure that that person who initiated the call in the first place has had their issue resolved by the appropriate and respective humanitarian entity. By contacting Awaaz, we received much needed health support for our sick children. Awaaz gives me hope, and I will share our issues with them again in the future. And what this reinforces is that through Awaaz, we are able to instill a sense of confidence, a sense that these people who desperately need this help, often in terms of life-saving assistance, are being listened to. And when they have issues, those issues are taken seriously, and they are reacted to quickly and very much in a timely manner. On this slide, you can see testimonials coming actually from some of the partners with whom we operate. Based on findings from past distribution monitoring, we have found that some beneficiaries do not feel comfortable reporting program-related issues directly to us. And this has come from the International Rescue Committee. This shows that it's a two-way mechanism. We listen and react to what comes in off the ground from those people desperately in need. And then the partners themselves in the humanitarian sector, in Afghanistan in particular, through the humanitarian cluster itself, are also able to benefit from the information that we are able to pass to them from the people on the ground. The Awaaz Center itself is the very first interagency, collective information and accountability center that has ever been established here in Afghanistan, and is very much based on the success of UNOPS's similar facility in Iraq that was established in 2015. At the bottom there, you can see another coming in from one of the health cluster coordinators, one of our partners, saying that through the information shared by Awaaz, we were able to identify a group of approximately 150 newly displaced households and assist them through mobile health teams. What's key here is that while we take a call from one individual, it is most likely that that one individual making the call represents a larger group of people. The average family size here in Afghanistan is 7, and it's often much more than that. So one call representing a family, representing a village, or representing a community can have much greater impact in terms of the numbers of people affected by the services provided by Awaaz. And indeed, in some cases, when we receive a call, one call from a community, the impact of Awaaz passing that information to the humanitarian partners and their subsequent action in that community, from that one call, we can actually impact up to in the region of 1,000 people. And the 140,000+ calls that we have received so far, we estimate has actually resulted in a positive impact to over 1 million people. COVID-19, of course, has affected everyone around the world in 2020. We in Awaaz are working very closely with our partners, especially in the health sector, in particular the WHO. And indeed, we took our first call as early as February this year, before the pandemic had really taken a grip in Afghanistan. We have done whatever we can to ensure that people on the ground are not only receiving assistance from a COVID-19 perspective, but also through awareness-related messaging, we have contributed to making people aware of the pandemic's presence in the country, and also encourage them and educate them about various aspects of this virus. As you can see in the bottom right of the slide, for example, somebody said to Awaaz that they had heard that rain can wash away the virus and asked us if that was true. And we're in a position to be able to make it very clear what the conditions are with regard to COVID-19 and what precautions they should be able to take in order to mitigate the risk to them, their families, and their communities. In terms of the way forward, Awaaz has already proven over the last 2+ years that it provides a very significant assistance to the humanitarian sector in all respects. The people of Afghanistan live in very troubled times. We see conflict, and we anticipate we will see conflict going into 2021 and potentially beyond. Awaaz needs to remain sustainable. For that sustainability, we need to make sure that our coverage and the capacity of the call center itself is maintained and, wherever possible, expanded. We need to make sure that we put in place enhanced monitoring and evaluation mechanisms to ensure that the people who are most in need receive the best service on behalf of the international community as well as the host government. Peace and stability remains a major threat, as do the environmental disasters, unfortunately, which this country suffers, whether it be earthquake, flooding, or drought. We need to ensure that this facility, now that it's established, now that it has achieved the outreach across the country, now that Afghans are aware of the toll-free number 410, that it remains in place in order to make sure that those multiple stresses and shocks that so many Afghans continue to suffer are mitigated, addressed in the best possible fashion in order to improve their lives, to give them hope, and make sure that as time passes, we move Afghanistan out of its fragile state and into an area in which every Afghan not only has the hope, but has the ability to reach their own personal destinies. Thank you very much for listening to me today. And I would like to take this opportunity once again to thank our partners, as you can see on the slide here, UNHCR WFP, who were so instrumental in helping set this facility up, and also to ECHO and the Afghanistan Humanitarian Fund for their continued financial support to make sure that all collectively address the needs of the Afghan people. Thank you, and I'd be more than happy at this stage now to take any questions that people might have. Okay, thank you. The first question is, how do we reach isolated people who don't have anything with which to call us on? This is a very good question. Thank you very much indeed. Our outreach, as you could have seen from the dashboard, is extensive, and we do actually reach all 34 provinces of Afghanistan. As I said, it is a mobile telephone or telephone-free hotline 410, and people have generally greater access now than ever before to telephone technology. Where those people do not have the phones, they are able to communicate with people who do have telephones and can call in on their behalf. And as a result of that, we see this very large number of calls that have been received and actioned to date. I've got another question here. Was the necessary infrastructure already present in the country, or did you need to invest in infrastructure as well? Was this a big challenge? Another good question, thank you. In terms of infrastructure, I assume that you are asking about telephone network infrastructure. The infrastructure has been here for some time, and it continues to expand every year. And as it expands, obviously the coverage expands. And like any country in the world, we see dead spots, but the Afghans are very robust and very resolute. And they do make sure that they do have access to phone coverage by moving if necessary or communicating in other means to people who do have the phones. We are reliant on the mobile telephone technology infrastructure, which sometimes, unfortunately, also becomes victim of violence itself and is targeted by anti-government elements. And where that takes place, we rely on government to replace that technology so that the network remains in place. Another question asks, do we plan to multiply the mobile health teams to break the digital barriers? The mobile health teams are represented by the entities who are within the clusters, whether it's the health cluster, the protection cluster, or other clusters focused on humanitarian responses. Those teams are able to react not only directly with their own people on the ground, but also on the basis of the data and the information passed on a confidential basis by Awaaz. We ourselves don't have any mobile teams, and we rely on the effectiveness, the flexibility, and the timely responsiveness of our partners in the health sector, in the protection sector, in order to react as appropriate. And then we feed that back and check with those callers to make sure they have received the assistance they so desperately need. Another question is, what are the most frequent requests made to you over the phone? Another good question. Thank you very much. The dashboard shows basically all the types of different calls we get, whether they're sectoral in terms of food, protection, health, or others. We do find that the majority of calls are about food and shelter. That is what returnees and displaced persons in this country are most in need of at all times. And this is especially relevant as Afghanistan now approaches yet another winter. And the displaced people and the returnees often have to fight not only against the other man-made issues they have to address, but also the elements. And during the winter here in Afghanistan, it becomes bitterly cold. So shelter is of great importance, and being able to get sufficient food to feed the families is also equally important. The next question is, how do you ensure the privacy of your interactions with vulnerable callers? As I mentioned in the presentation, we operate on a purely confidential basis, and all data that is taken into the call center is managed here locally on the UN compound, and it is not released beyond our own settings. We also operate very closely in accordance with European data protection measures. And those measures are what actually define how we apply confidentiality of our data. So it is all very confidential, and it will continue to be that way in the future. Next question is, do you have innovative ideas to address the gender imbalance of people who contact you? That's a very good question. It's also a very interesting question. We don't have innovative ideas to address the gender imbalance, because that would not come under the terms of reference of such a collective multi-agency information accountability center. We do, however, collect the data in terms of ages and gender of the callers, and all that data is made available to our humanitarian partners. We do, on the whole, but not exclusively, receive calls from the heads of the household who tend to be male. But we also get a huge amount of calls coming in as well from females, either women who could either be heads of households in their own right, or not the head of household, or younger women and even girls call in. All that data is passed on to the respective agencies and partners with whom we support, and it is for them to react to that. And if there is an issue on gender, whether it be gender imbalance or gender-based violence, then we rely on those entities who have the speciality and the expertise to deal with such issues. The next question is, has the service been presented to any institutions in the region to be implemented on a larger scale? The answer to this good question is essentially yes. As I mentioned in the presentation, we have replicated, UNOPS has replicated our successful implementation of such a call center facility in Iraq in 2015, here in Afghanistan. And we are advocating the success of both the Iraq example and this Afghanistan example, so that it can be replicated elsewhere, not only in in the region, but also wider in the region. And we're hoping very much that as a result of the lessons that we have learned and the added value that we have demonstrated that there will be interest to have such facilities elsewhere in the world, especially in trouble spots, to make sure that all affected communities and populations can receive the same benefits. The next question is corruption or political issues ever an obstacle in providing these services? If what is meant by these services, you are referring to the services of this interagency call center, then the answer is simply no. This is a UN operated, UN ops provided facility, and we don't have any issues in terms of governance or corruption. There is inevitably an issue of corruption in this country, as there are in so many countries all around the world, including my own. So we have to take that into account, or rather our partners have to take that into account when reacting to these calls. But within the call center itself, we are very fortunate to have the full support of our partners and the full support of the government of Afghanistan. I think, as far as I can see, there are no more questions at this stage. I'll leave it just for a moment to see if anyone else would like to throw a question in. Or if anyone who's already asked a question, for which many thanks, if you feel that I haven't answered it sufficiently, or you'd like to go down on a tangent to the answer, then please feel free also to follow up on your original question. We have a few moments left before the Paris Peace Forum will move on to the next presentation. If anybody should have any follow-up questions, then please, I believe there is a facility in which you can raise those questions on the Paris Peace Forum platform, and we'd be more than happy to come back and answer any subsequent questions in due course offline. Okay, we now have less than 1 minute left, and I don't see any more questions coming in. So let me, if I may, just use the last remaining seconds to express our thanks to the Paris Peace Forum for facilitating this presentation of the Awaaz call center. Thank you all for listening. Thank you for your very interesting and pertinent questions. And lastly, once again, thank the government of Afghanistan and all our international partners who have allowed this very key humanitarian facility to be established and maintained. And we look forward to providing that service to the Afghan people, especially those most in need, in the months and years ahead. Thank you very much.